Our today's topic is about adaptation of normal diet for changing needs. What is diet adaptation? Diet adaptation is when a person changes their diet. This includes modifying the diet because of a medical conditions or in preparation for a procedure or surgery. This is most often necessary for certain medical procedures. For example, a doctor may have a patient start a clear liquid diet before a colonoscopy, which is a procedure that looks inside the colon using a camera called a colonoscopy, which is a procedure that looks inside the colon using a camera called a colonoscopy. What is a normal diet? First of all, we are going to discuss about the normal diet. Normal diet is modified to feed young children, elderly members, and sick members of the family. The planning of diet, whether normal, soft, or liquid, has the same basic objectives to maintain or restore the good health of the person through a proper diet. The modifications are based on the changed needs of the individuals due to age or sickness. Normal diet forms the basis of all modifications of diet for age and sickness, but due attention must be paid to nutritional needs of the individual. Normal diet is planned according to the recommended daily dietary intake, which are designed to meet the needs of all healthy persons and may not meet the needs of sick persons. The nutritional requirement depends on the activity, the increased or decreased demands for certain nutrients, which need to be considered in planning the diet. A normal diet helps to protect against malnutrition in all its forms, as well as non communicable diseases, including diabetes, heart disease, stroke, and cancer. Unhealthy diet and lack of physical activity are leading global risks to health. Healthy dietary practices start early in life. Breastfeeding fosters healthy growth and improves cognitive development and may have longer term health benefits, such as reducing the risk of becoming overweight or obese and developing non communicable diseases later in life. Energy intake should be in balance with energy expenditure. To avoid unhealthy weight gain, total fat should not exceed 30% of total energy intake. Intake of saturated fats should be less than 10% of total energy intake, and intake of trans fats less than 1% of total energy intake. With a shift in fat consumption away from saturated fats and trans fats to unsaturated fats, and towards the goal of eliminating industrially produced trans fats. Limiting intake of free sugars to less than 10% of total energy intake is part of a normal diet. A further reduction to less than 5% of total energy intake is suggested for additional health benefits. Keeping salt intake to less than 5 grams per day, equivalent to the sodium intake of less than 2 grams per day, helps to prevent hypertension and reduces the risk of heart disease and strokes in the adult population. Consuming a normal diet throughout the life course helps to prevent the malnutrition as well as range of non-communicable diseases and conditions. Increased production of processed foods, rapid urbanization, and changing lifestyle have led to a shift in dietary patterns. People are now consuming more foods high in energy, fats, free sugars, and sodiums. And many people do not eat enough fruits, vegetables, and other dietary fibers such as whole grains. The exact makeup of a diversified, balanced, and healthy diet will vary depending on individual characteristics. For example, age, gender, lifestyle, and degree of physical activity, cultural context, locally available foods, and dietary customs. The basic principles of what constitutes a healthy diet remains the same. A healthy normal diet includes the fruits, vegetables, legumes, which includes lentils and beans, nuts and whole grains, for example, unprocessed maize, millet, oats, wheat, and brown rice. At least 400 grams of fruits and vegetables per day, excluding potatoes, sweet potatoes, and other starchy roots. Less than 10% of total energy intake from the free sugars, which is equivalent to 50 grams for a person's of healthy body weight, consuming about 2000 calories per day. But ideally is less than 5% of total energy intake for additional health benefits. Free sugars are all sugars added to foods or drinks by the manufacturer, cook or consumers, as well as sugars naturally present in honey, syrups, fruit juices, and fruit juices concentrates. Less than 30% of total energy intake from fats, unsaturated fats, are preferable to saturated fats, which is found in usually fatty meat, butter, palm, and coconut oil, and trans fats of all kinds, including both industrially produced trans fats, which basically found in baked and fried foods and pre-packaged snacks and foods such as frozen pizzas, pies, cookies, biscuits, wafers, and cooking oils and spreads. Intake of saturated fats be reduced to less than 10% of total energy intake and trans fats to less than 1% of total energy intake. Industrially produced trans fats are not part of a healthy diet and should be avoided. In the first 2 years of a child's life, optimal nutrition fosters healthy growth and improves cognitive development. It also reduces the risk of becoming overweight or obese and developing non communicable diseases later in life. Healthy diet for infants and children is similar to that for the adults, but the following elements are also very important, which includes infant should be breastfed during the first 6 months of life. Infant should be breastfed continuously until 2 years of age and beyond. From 6 months of age, breast milk should be complemented with a variety of adequate, safe, and nutrient dense foods. Salts and sugars should not be added to complementary foods. Eating at least 400 grams of fruits and vegetables, or at least 5 portions of fruits and vegetables per day, reduces the risk of non communicable diseases and help to ensure an adequate daily intake of dietary fibers. Fruits and vegetables intake can be improved by always including vegetables in meal, eating fresh fruits and raw vegetables as snacks, eating fresh fruits and vegetables that are in season, and eating a variety of fruits and vegetables. Reducing the amount of total fat intake to less than 30% of total energy intake helps to prevent unhealthy weight gain in the adult population. The risk of developing non communicable diseases is lowered by reducing saturated fats, to less than 10% of total energy intake, reducing the trans fat to less than 1% of total energy intake, and replacing both saturated fats and trans fats with unsaturated fats, in particularly with polyunsaturated fats. Fat intake, especially saturated fats or industrially produced trans fat intake, can be reduced by steaming or boiling instead of frying when cooking, replacing butter and ghee with oil rich in polyunsaturated fats such as soybean, canola, corn, safflower, and sunflower oils. Eating reduced fat, dairy foods, and lean meats, trimming visible fat from meat, and limiting the consumption of baked and fried foods and pre-packed snacks and foods that contain produced trans fats. Most people consume too much sodium through the salt and not enough potassium. High sodium intake and insufficient potassium intake contributes to high blood pressure, which in turn increases the risk of heart disease and stroke. Reducing the salt intake to the recommended level of less than 5 grams per day could prevent 1.7 million deaths each year. People are often unaware of the amount of salt they consume. Most salt comes from processed food such as ready meals, cheese, and salty snacks, and from the foods consumed frequently in large amounts, for example, breads. Salt is also added to foods during cooking and at the point of consumption, such as table salt. Salt intake can be reduced by limiting the amount of salt and high sodium condiments, such as soy sauce, fish sauce, when cooking and preparing the foods, not having salt or high sodium sauces on the table, limiting the consumption of salty snacks, and choosing products with lower sodium content. Some food manufacturers are reformulating the recipes to reduce the sodium content of their products, and people should be encouraged to check nutrition labels to see how much sodium is in a product before purchasing or consuming it. Potassium can mitigate the negative effects of elevated sodium consumption on blood pressure. Intake of potassium can be increased by consuming fresh fruits and vegetables. In both adults and children, the intake of free sugars should be reduced to less than 10% of total energy intake. A reduction to less than 5% of total energy intake would provide additional health benefits. Consuming free sugars increases the risk of dental caries. Excess calories from foods and drinks high in free sugars also contributes to unhealthy weight gain, which can lead to overweight and obesity. Sugars intake can be reduced by limiting the consumption of foods and drinks containing the high amounts of sugars, such as sugary snacks, candies, and sugar sweetened beverages. Modification of a normal diet may be modified by to provide changes in consistency as in fluid and soft diets to increase or decrease the energy value, reducing the diets to include greater or lesser amounts of one or more nutrients, high protein and low fiber diets to increase or decrease bulk, high and low fiber diets to provide foods bland in flavors to include or exclude the specific foods as in allergic conditions to modify the intervals of feeding. Dietary modifications are basically changes made during food preparations, processing, and consumptions to increase the bioavailability of micronutrients. and reduces the micronutrient deficiencies in food at the commercial or household level. A modified diet is any diet altered to include or exclude the certain components such as calories, fat, vitamins, and minerals. Diets are typically modified for therapeutic reasons, including treatment of high blood pressure, low body weight, or vitamins and mineral deficiencies. About diet modifications that may help your condition, and follow up with a nutritionist to help you make the best dietary changes. Dietary modifications are the changes made during the food preparations and processing. Dietary modifications are of basically two types, which one is the standard diet and other one is the modified diet. Standard diet is a diet that includes all foods and meets the nutrient needs of healthy people, also called a regular diet. And modified diet, a diet that is altered by changing food consistency or nutrient content, or by including or eliminating the specific foods, also called a therapeutic diet. Therapeutic diet is a meal plan that controls the intake of certain foods. Its practices followed in many hospitals as part of the treatment of a medical conditions and are normally prescribed by a physicians and planned by a dietitian. A therapeutic diet is usually a modification of a regular diet. Diets are modified for consistency, nutrition, and new methods of making regular dishes. The normal diet may be modified to provide a change in the constituents of the diet, maintain, restore, or correct the nutritional status, to include the all nutrients in the diet, increase or decrease the energy value of the diet, to provide the foods bland in flavor, to modify the intervals of feeding. The type of the modification relates to the condition and need of the individual concerned. The selection of foods is made on the same principles as the normal diet using the daily food guide. Many people, including infants, need soft diet because they have no teeth. The only change made is in the consistency of the food served. No restriction in place on food selection. This diet is sometimes described as mechanically soft diet. Mechanically soft diet comprises soft textured foods that a person has pureed, mashed, or blended. It is ideal for the people who find it difficult to swallow solid foods. It is possible to include all the major food groups in a mechanical soft diet. It can be as nutritious as any other diet. Many people can benefit from eating a mechanical soft diet. The diet omits a variety of textures. It does not have to taste bland. A mechanical soft diet consists of any foods that can be blended or chopped using a kitchen tool such as knife, grinder, blender, or a food processor. These processes break down the structure of the foods to make them soft and easy to eat without biting or chewing. People also call the foods that make up a mechanical soft diet textured modified foods. It is common for healthcare professionals to recommend this kind of the diet for the people who have had surgery or who are recovering from an illness. Unlike the bland diet, which comprises easily digestible foods, a mechanical soft diet focuses only on the textures of the food. It does not restrict the spices, fried foods, or foods that cause the gases. Eating a mechanical soft diet might be necessary when a person is receiving from an illness or surgical procedure or finds swelling difficult for any other reason. Dysphagia is the medical term for difficulty with swallowing. Dysphagia occurs when there is a problem with one of the body parts involved in swelling, such as the tongue, cheek muscles, or throat. Any condition that weakens the muscles and the nerves used for swallowing can cause dysphagia. The condition can also occur when signals from the brain to the body parts involved in swelling do not work correctly. A person may need to eat a mechanically soft diet if they are removing from head, neck, or mouth surgery, experiencing difficult chewing or swallowing, recovering from a stroke, living with the long-term conditions that affects the chewing and swallowing, such as cerebral palsy or Parkinson's disease, living with a cancer of the head, neck, or esophagus, living with the neurodegenerative conditions, recovering from bariatric surgery, dealing with the dental problems such as wearing ill-fitting dentures or having no teeth. A mechanical soft diet can be just as nutritious as a regular solid food diet because it can include all the major food groups. For a healthy, balanced diet, it is important to include the foods from each of these groups, which include dairy products, fruits and vegetables, protein rich foods, starchy and grains. Eating a mechanical soft diet takes careful planning and preparation. So it can take a while to get used to. If eating normal sized meal is difficult, a person can consider eating smaller meals or adding regular nutritious snacks throughout the day. Consuming high calorie, nutrient rich drinks can help a person meet their nutritional needs. These can be shop bought or homemade by blending fruits with milk, yogurt, ice cream, or even silicone to boost protein. Including a wide variety of foods not only prevent boredom but also allows a person to get the vitamins, minerals, and energy their body needs. The foods recommended for a mechanical soft diet vary from person to person. Foods that one person can chew or swallow with ease might cause discomfort for someone else. It is important to seek the advice of a registered dietitian or doctor before following a mechanical soft diet. A vast variety of the foods can be included in a mechanical soft diet such as milk, yogurt, cottage cheese, cheese sauce, cream cheese, milkshakes, evaporated milk, condensed milk, smoothies, frozen yogurt, dairy ice creams, cooked or pureed vegetables, vegetable juices, smooth mashed potatoes, vegetable soups, pureed soft foods or cooked and pureed harder foods, scrambled, poached, or soft boiled eggs, ground or finely minced cooked meats or fish, finely chopped or mashed potatoes, tuna, chicken, or egg salad made with mayonnaise or yogurt, mashed beans, peas, or legumes, finely diced or ground meatloaf, oatmeals, moist white rice, cereals softened with milk, soft pancakes, moistured with pureed fruits or syrup, soft bread rolls, soft cooked pasta, bearing in mind that small pasta varieties such as macaroni may be easiest to swallow, custard, pudding, ice creams, rice puddings, soft cookies, honey, fruit jellies, smooth peanut butter, margarine, and oils. People may wish to avoid the foods while adhering to a mechanical soft diet as they require throughout the chewing, which include the hard cheese, yogurt containing the chunks of fruits, raw vegetables, french fries, fruits with skin and seeds, dried fruits, fried chicken, fish, fish with bones, thick cold cuts, sausages, dried beans, nuts and seeds, popcorns, hot crackers, pastries, cookies, desserts containing dried fruits or nuts. A dental soft diet is an other modified diet which consists of easy to chew or easy to swallow foods. Soft diet, dental soft diet as one that is low in fiber, fat, and connective tissues, while it limits the food choices considerably. It does include a wide variety of foods in all food groups and usually does not limit the spices you can use in food preparation. The dental soft diet allows you to eat moist, tender meats, poultry and fish, as well as eggs and creamy peanut butter for proteins. It includes cooked vegetables and lettuce, cooked or canned fruits and mushy fruits and vegetables like bananas, pasta, rice, cooked grains, lentils, and legumes add texture and some fibers to a dental soft diet, and desserts including pudding, soft cakes, and ice creams. If you are cooking for someone or a dental food diet, avoid hard foods as well as meats like steak that are difficult to chew. Skip the crunchy peanut butter and apples and pears. Avoid breads and other foods with seeds and nuts in them. Remove the skin from oranges and other citrus fruits. Stay away from dry cookies and crackers that might scratch tender throat or gums tissues. Avoid any foods that hurt your mouth or throat. Doctors and dentists prescribed a dental soft diet for the patients who may have trouble chewing and swallowing for various reasons, ranging from new braces and tooth extractions to a sore throat. Soft diet after they adjust the braces or at any other time that braces, bridges, plates, or other dentures cause the mouth tenderness. Doctors also prescribe the soft food diets for a short time after an illness or long term to patients who have muscular conditions like dysphagia that make it difficult for them to chew or swallow the foods. Other conditions that may require a dental soft diet include joint problems, stroke, or recovery from oral or throat surgery. Always keep in mind that each surgery is different and you should follow your dentist post operative instructions regarding what is acceptable to eat. Some surgeries require a patient to be on a liquid diet for so long and then progress to soft diets. Any of the foods to eat after dental surgery can be liquefied using a blender. Our favorite is the dental soft diet. These liquefying blenders can also make a variety of the flavorful healthy drinks or smoothies, which can include raw vegetables that are extremely helpful in the healing processes. Foods that affects the that must be eat after dental surgery, implants, or teeth extraction includes baby foods, baked beans, mashed if necessary, black beans, baked apples, bananas, biscuits, broccoli, and cheesecake, peas, creams, cupcakes, custard, donuts, egg salad, fruit juices, smoothies, ice creams, soups, spaghettis, spinach, sweet potatoes, and foods which must be avoided after dental surgery. Tomatoes or tomato sauces, acidic and may burn or cause the pain immediately after dental surgery. Orange juices, be cautious with orange juice or any other acidic juices. They may cause burning or pain if ingested too soon after dental surgery. Anything silly may get stuck in a surgery site and cause discomfort to get infected. Much like a seed, this can get lodged and cause pain. Popcorn, the corn's hulls can become lodged. Spicy foods may lead to pain and discomfort. Crunchy or difficult to chew foods may interfere with the blood clotting following the dental surgery. Over the counter mouth rinse, it's not a food but patients commonly use the mouth rinses such as Listerine or Scope following a dental surgery, and it significantly interferes with healing, so it's worth mentioning. What does a modified consistency means? What is modification in consistency? These diets are used in the treatment of gastrointestinal tract. These diets can range from a very low residue diet to a very high fiber diet. Method of feeding is oral, which includes diets without solids, which include liquid diets. Liquid diets consist of foods that are liquid at room temperature and are used in febrile states, acute fever, and post operative conditions. Soft and low fiber diets is between liquid diet and normal diet. Soft diet include both liquid and solid foods which contain restricted amounts of indigestible carbohydrates and no tough connective tissues. The diet can be made soft by cooking, mashing, puring the foods used in a diet under normal conditions. One could also use of refined breads, cereals, vegetables and fruits. This diet is soft in texture and bland to taste. And low residue diets. The diet is made up of foods which can be completely absorbed, leaving little or no residue for feces formation. This diet is low in its mineral and vitamin content. Such diets need to be supplemented, and foods high in fiber should be omitted. 2 cups of the milk may be permitted on a daily basis. Fruits and vegetables without skin are allowed. Meat should be tendered or ground to reduce the connective tissues. The diet is usually used in the severe diarrhea, acute diverticulitis, and post operations. And in high fiber diets plays a significant role in colonic functions. A high fiber diet includes foods that have a high fiber content. Fiber is essentially the outer crust of fruits, vegetables, and grains that is not broken down by the body. It helps in excretion of body wastes. It also well known that fiber regulates the cholesterol level. Oats, beans, peas, Brussels sprouts and carrots, and rich sources of fibers recommended in case of constipation or high cholesterol. This is normal diet with fiber increased to 15 to 20 grams daily. Modification or changes in nutrient composition of the diet to increase or decrease the availability of nutrients to suit the body requirement limitation of a person, which includes high calorie diet. This is a normal diet with an increase in the calorie level to 3000 or more. If appetite is poor, small servings of highly reinforced foods are given. The diet may be modified in consistency and flavor according to specific needs. Excessive amounts of food that have a low calorific value and fried foods which disturb the appetite should be avoided. These diets are prescribed for weight loss, fever, hyperthyroidism, and burns. Another diet is low calorie diet. These diets control the calories, carbohydrates, proteins, and fat intake in balanced amount to meet the nutritional needs and control blood sugar and weight. This is a normal diet with energy value reduced to 1500 to 1200 or 1000 calories. Protein level should be at 65 to 100 grams. Supplements of vitamin A and thiamine are usually required for diets below 1000 calories. These diets are prescribed for reducing the body weight in diabetes mellitus, cardiovascular diseases, hypertension, gout, gallbladder diseases, and preceding the surgery. Another diet is high protein diet. These are diets high in plant and animal proteins used to treat the malnutrition or to increase muscle mass. High protein diet of 100 to 125 grams per day may be prescribed for a variety of conditions like fever, hyperthyroidism, burns, after surgery, diarrhea, elderly, and alcoholics. In low protein diets, people reduce their intake of proteins. Such a diet is often prescribed to people with kidney or liver disorders. Low protein diets are usually prescribed for conditions like hepatic encephalopathy, acute and chronic glomerulonephritis, nephrolithiasis, acute and chronic renal failures, inborn errors of metabolism. In severe liver disorders, when protein cannot be synthesized, excess ammonia cannot be converted to the urea for excretion, and the patient develops the hepatic coma. In this situation, protein levels must be decreased or completely restricted for a few days. Patient with kidney requires low protein diets since the kidney cannot excrete nitrogenous waste. Diet containing 18 to 22 grams of high biological value protein may be needed for the chronic uremic patients, which is not being dialyzed. Low protein diets are also prescribed for patients with inborn errors of metabolism that result from lack of enzymes of the urea cycle. In fat controlled diet, amount and type of the fat allowed. The total calories from the fats should give about 30% and 35% of the total calories, with 10% from the saturated fat and 12 to 14% from polyunsaturated fats. Even the intake of cholesterol also is reduced from the average daily intake of 600 to 300 mg. Usually, fat control diets are prescribed for gallbladder diseases, non-tropic spur, celiac disease, cystic fibrosis, atherosclerosis, myocardial infarction, and hyperlipidemia. Another diet is the low sodium diet. In this diet, the mineral content of the diet may be also modified. Four levels of sodium restrictions are used: 250, 500, 1000, or 2400 mgs. The diet excludes excess salty foods and salt in cooking and at the table. This diet is used both to prevent and treat the edema. It is prescribed for cognitive heart failure, hypertension, liver, and renal disease. Then sodium must be added back by means of the diet. There are certain risks and benefit. By choosing an altered consistency diet, you may experience some potential benefits, which includes eating finely chopped, pureed, or commonly softened foods or drinking thickened liquids may make it easier to eat and drink. The risk of choking or aspirating may be minimized. If you are able to improve your chewing or swallowing, you may eat and drink more, keeping you well nourished and hydrated. By declining an altered consistency diet, you may experience some potential health safety risk. You may have an increased risk of aspiration or choking, which could cause shortness of breath, physical discomfort, and severe pulmonary complications, including death. You may compromise your dental status, causing mouth pain or tight jaws. By changing to a diet of your choice, you may experience these potential benefits, which include you may enjoy food or drinks more if they have a familiar texture and consistency. By eating and drinking familiar foods, you may keep your weight within your usual range and may decrease your risk of dehydration. You may get more choices for meals and snacks by adding foods with familiar textures to your diet, which may also have a positive impact on your health and happiness. You may not feel left out or different during meals and food related community life. Each person will have an individualized plan with guidelines specific to their needs. It is very important that you sit properly for eating your meals. Improper positioning might increase the risk of aspiration and make it harder to eat, adding to a loss of independence. Use a chair that will allow you to sit close to the table. Sit straight in a chair with hips positioned back in the seat, forming a 90-degree angle. Your thighs should be fully supported. Bend your knees at a comfortable angles and have your feet fully supported. Both your arms should be supported, which helps keep your body upright and in center of chair. Do not tilt your head backwards while eating or drinking. Tuck chin in slightly. Always minimize the risk of choking by eat slowly. Chew the food well. Don't talk while food is in your mouth. Pay attention and stay older during mealtime. Cut items into small pieces. Cook or mashed carrots, corns, or other vegetables. Spread peanut butter thinly or prepare mixed with jelly or pureed foods. Meatballs, grapes, small sausages, and other round formed foods should be cut into smaller pieces. Swallowing problems don't always mean a change in food they enjoy. There are foods normally pureed milk like mashed potatoes, sweet potatoes, pudding, as well as many soft foods that can be mashed or finely chopped.